just wanted to respect that protocol, and I appreciate the opportunity to speak for the second time. And part of the reason for the second time is I really wanted to listen to my colleagues and greatly appreciated Mr. Dax and Ms. Veltri's answers. So let me take that through from an analysis standpoint. The Senate Republican had proposed Senate Bill 1006. I'm not sure if we're going to get a public hearing out on that, but as I'm listening to you, I see a tremendous amount of similarity and the same frame of mind and thinking, particularly one of the components of reinsurance. And one of the questions I wanted to ask is, has the administration considered with the potential granting of federal funds that in utilizing the 1332 exchange and potential federal healthcare money and Medicare, et cetera, that we could offset the assessment and tax on premiums? That is it a possibility that we could use allocated federal funds in offsetting that cost to be able to create the reinsurance product? I know you cited it in your bill, but and in your testimony, but didn't go into deep discussions about that. I think reinsurance may be a very viable product at this time to be able to offset some of the cost considerations we're trying to address. Any thoughts on that question?
Yeah, the administration supports reinsurance. We had a governor's bill last year that included reinsurance. The landscape has changed with the shift in federal administrations and with the passage of the recent bill. What we want to do is buy ourselves the time, not for you to hear from just me and Vicki, but to hear from Vicki and the relevant agencies and experts on a soup to nuts plan for how this $50 million, 30 in the first year, could be best put to use for the people of Connecticut and put to use in a way that maximizes federal dollars in that effort. So reinsurance, we know from the Wakely report that AHCT has commissioned, and you have probably seen, brings in roughly $1 federal dollar for every dollar we spend as the state. That's not bad. That's about what we get in Medicaid. There may be opportunities through more targeted premium supports or cost sharing reductions to bring in not one-to-one federal dollars, but a substantially higher federal match, and to target that match and the state dollars at the population most in need. So we're really open to whatever story the numbers tell us in terms of how we can best serve our constituents.
I am so appreciative and grateful for the open-mindedness and the offer of collaboration. It is indeed welcome for us to get the best product at hand. I think the second component that we share a lot of similarity with Senate Bill 1006 is the fact of addressing the cost of prescription drugs. I think the administration proposed some very different ideas than the pre-existing idea of Canada's pricing, and I'm very much receptive to engaging in that conversation. But I want to reiterate that for the Senate Republicans and the House Republicans, the idea is looking at prescription drugs as another significant cost factor. And I wanted to compliment the governor and yourself for that kind of a perspective. The third issue that we looked at was benchmarking, and that shared a lot of similarities in regards to, and I wanted to share that I've had some conversations with Ms. Jean On, who was the Chief Strategic Officer, I believe in some capacity, with Bay State Medical Centers, now with Nuvance. And she saw firsthand the more recent utilization of benchmark. And we have great talent in our state to be able to utilize and make a best benchmarking based upon lessons learned. Do you have any particular thoughts in regards to how the legislative branch can help policies to the administration in crafting a benchmarking program that will be truly effective in managing cost and being able to have some data points? That could be you or Vicki.
Are you deferring to me? Because I think I can weigh in on this one. Okay, so
it was a setup for you, Vicki.
It was a nice setup. Thank you very much. And we have been working. I want to thank this committee, the Public Health Committee. We've had a really good relationship on the benchmark work. It's even pre-executive order. There were a lot of conversations going on about implementing a benchmark program in Connecticut. And, we did start with the executive order in part because we had a bill last year. We had a bill the year before. It was late in session. We had a bill last year. The session died, as we all know. And we proceeded to work on it. And we think like the other states that this is a really important thing to do. The transparency efforts are really critical to exposing the underlying costs that are driving health, health premiums and cost sharing that people are paying, right? That data is slowly coming out. We think that we will have to codify the benchmark. And I'm sorry, I will say in advance that I'm not going to be able to testify Thursday in person, but we are submitting testimony on it. We will have to codify that work. I think what's slightly different than when we initially proposed the bill is that we're actually working on it, right? So we're learning things as we go on how to best codify it. So we're in the first year of actual implementation of that benchmark. So we were kind of proposing that we come back next session with an ironed out bill that's consensus, that isn't going to be highly dramatic because lots of these kinks have been worked out in it. And we invite people to stay engaged in it. We do meet monthly with our legislative partners, the chairs and the ranking members and the vice chairs. We've been meeting every month or trying to with most everybody on it. But the key there is going to be when you see the data, right, that we will be showing, what action are we going to take together to address what we're seeing in these data? And those are going to be very difficult conversations, just being honest, like we're having today. Right?
No, it absolutely. And we have the talent pool. And as I said earlier, your demonstrated experience and grassroots effort is critical for us to be able to utilize that. And the cat go behind your back.
Yes, I'm sorry.
That's okay. That's okay. We had a baby.
Usually one makes an appearance, sometimes two.
Now, the fourth part of Senate Bill 1006, we talked about, and it's really important, is the fact of transparency and accountability. And I think I don't want to repeat myself or have you repeat yourself. That is absolutely paramount for any system to truly be effective and sustainable. So I appreciate both of your time. And I just want to reiterate that the Senate Republican are looking to create a better way, working with the administration to finding solutions. And I want to applaud the administration and all its staff members for being open and collaborating and working with all of our various partners. I think ultimately the best way we can contain cost and be able to manage a system moving forward is to address an entire ecosystem, but to do it in a collaborative way with existing structure. The idea of creating something brand new may be something that may be great and ideal, but the reality comes into a brutal confrontation that sometimes these challenges, like I said earlier, if we could solve healthcare cost containment, we would have done it 30 years ago. But nevertheless, I really appreciate all of your time and effort and my ability to be able to share that, at least for me, as a Senate Republican, that 1006 reflects a lot of the values and being able to collaborate and work together. So thank you, Madam Chair, for the opportunity. And thank you all for your work again and your indulgence and time. Thank you, ma'am.
Thank you.